you're watching this, then you have chronic or severe back pain and have most likely been diagnosed with disc bulge or hernia, sciatica, stenosis, deterioration, or facet arthrosis. Or maybe you just don't know where to turn or who to trust for relief of your chronic back pain. Well, sit back and relax. Let Spinal Aid Centers of America show you how we can help.
The human spine is made up of a series of bones, called vertebrae, connected together by ligaments and muscles. The spine is designed to protect the spinal cord, the superhighway that carries electrical signals from the brain to the rest of the body. Each vertebra in the spine is separated by an intervertebral disc. For simplicity's sake, the disc can be likened to a jelly donut. It has a soft gel-like substance in the center called the nucleus pulposus, which is surrounded by a tough outer coating called the annulus fibrosus. The discs serve three primary functions. They act as shock absorbers to prevent compression fractures of the vertebrae. They provide mobility to the spine, allowing it to bend and twist. And they separate the vertebrae, allowing nerve roots to branch off from the spinal cord and travel to the rest of the body. The disc relies on the transfer of fluids and nutrients from the vertebrae above and below, as well as the outer layer of the annulus to stay healthy. Excessive loads on the discs result in increased pressure that slows the transfer of these vital fluids and nutrients. Continued wear and tear results in dehydration and disc degeneration. Excessive weight, poor posture, heavy lifting, or repetitive movements may accelerate this process. The most common feature of disc degeneration is the loss of fluid in the disc nucleus. As the discs shrink, the space between the vertebrae decreases, causing more bone-on-bone activity at the facet joint. This may cause pain and irritation, known as facet syndrome. Furthermore, disc dehydration causes the tough, pliable outer coating of the disc to become brittle and susceptible to cracks and tears that may lead to disc herniations. As we learned earlier, this outer layer of the disc has its own nerve supply. Small cracks or tears in the annulus alone may cause severe low back pain. As the tears worsen, the gel-like material of the nucleus begins to push through the annular wall, creating a disc bulge. As the condition progresses, the bulge applies a physical pressure to the nerve root. A compressed nerve often causes lower back pain and sciatica, a pain that radiates into the buttocks or down one or both legs. Under distraction, the pressure exerted on the disc is reduced dramatically, which may help draw the bulging or herniated gel-like material of the nucleus back into the center of the disc, relieving pressure on the nerves. Furthermore, reduced pressure helps the disc draw in the fluids and nutrients necessary for proper hydration and disc height.
Millions of people suffering from back pain are told prescription drugs, injections, or surgery are their only options. But an emerging non-surgical technology called spinal decompression therapy is gaining support in the medical community and giving back pain patients new hope.
Hello everyone, I'm Ren Scott, and welcome to this special broadcast on relieving back pain and a non-invasive treatment that's helped thousands of people get relief from back pain and get back to an active and pain-free life. As an Emmy Award-winning journalist, I spent 18 years researching and reporting stories that I felt were important. And I know from experience, when you're suffering with severe lower back pain, there is nothing more important than finding relief. You see, 5 years ago, when I was suffering with severe lower back pain, a friend recommended this treatment to me, and it provided back pain relief that changed my life. Because now, there's even more positive research to report and more success stories to tell.
If I sneezed, it hurt. I couldn't find a comfortable position to sleep in. Any bump in the car was excruciating. I couldn't understand why. I'm 26 years old, physically fit, incredibly active, and I couldn't understand why I was in so much pain. Back to being physically fit, starting to do yoga again, starting to do a lot more walking, and just even shooting my camera. I really miss that. So now I feel great.
When the pain was at its peak in my life, I was to the point to where I was even afraid to start picking up my kids because the pain, it would just send radiating pain down my back and lower leg. And it was affecting how I played with my kids, especially my son. He was very athletic and very rigorous boy, and I got tired of telling him, don't touch Dad. I am now able to play football with my son in the backyard. I go to the gymnastics with my kids and dance. I'm able to participate with them. We go on bike rides. And a great side note to this is I've actually started losing weight because I'm more active than I ever have been in the last 15 or so years.
I cried, and I cried, and I cried. And, everybody says, well, you know, you probably should have surgery. Well, I didn't have insurance, and I thought, I can't do that. I'm going to have to live like this. Life is great. It is. It just, like I said, it was a godsend. I mean, I couldn't imagine living with that pain.
The treatment all these people are talking about is called non-surgical spinal decompression, and it embraces a progressive, non-invasive approach to treating the source of your back pain, as opposed to the old-fashioned approach of using prescription medications or injections to try to mask the pain. In simple terms, during spinal decompression therapy, the patient reclines in a comfortable position, and a gentle pull works in an effort to relieve pressure between discs and allow the back to begin a natural healing process. In recent years, the growing popularity of spinal decompression therapy has attracted the interest of some of the top researchers in the country.
I think what's impressed me the most is not just this reduction of pain and the reduction of pain in the retrospective study, which seemed to lead us to believe it's long term. But I think what's impressed me the most is that when these patients, when we look at their disability and their activities of daily living, that they're improved. We hypothesize that it may decrease the pressure in the disc during the actual treatment period. And during that treatment period, where the pressure is decreased, we're increasing hydration, we're increasing nutrients to the injured disc, we're allowing more oxygen to come in there, and this is allowing for the disc to regenerate itself or repair itself. We've done some studies, again, preliminary data that's just published as of recent, that shows a correlation between increased disc height and reduction in back pain.
So who is a candidate for this procedure? Well, the latest literature on spinal decompression therapy says it can provide relief for cases of herniated discs, degenerative discs, sciatica, general lower back pain, and even failed back surgery.
My husband had to help me dress in the morning. He had to help me shower. I couldn't change my daughter's diaper. I couldn't hold her. I have my life back. Now I am absolutely pain-free. I'm holding a job, a steady job. Can have a great relationship with my daughter. I'm able to go to the park and play for hours with her. I'm able to give her showers. I'm able to shower myself. I don't have to ask for help to make my daughter food, to do dishes, to wash my own clothes. I mean, I got my life back. I truly got.
If you're like me, one of the first questions you'd ask about this treatment is, does it provide long-term relief? Well, of course, the answer to that is that every patient's different. But to address that very point, Dr. Pergolesi and his team went back and interviewed several patients long after their treatment was complete, and the results were extremely positive.
Roughly about 80% of them said they felt that the therapy was very good. When we asked if they would recommend the therapy, 90+% said that they would recommend the therapy to somebody else. When we asked what their pain was, even up 9 months out in some patients, again, they said that their pain was relatively the same score that they had when they stopped treatment. And that is very encouraging data. But I think what's impressed me the most is that when these patients, when we look at their disability and their activities of daily living, that they're improved.
You know, over the last few years, I've interviewed dozens and dozens of people who told me that they were told by their doctors that surgery was their only option. But they were fortunate enough to try spinal decompression therapy first and find out that surgery really wasn't necessary.
I really regret that I had back surgery. Once you do something permanent, then it's permanent. This is non-invasive, of course, and it certainly has helped me, and I strongly advise people to take a look at it. give it a shot before going into back surgery.
I was one step away from having my 4th spine surgery, and not only did this not only correct and give me back what I had not been able to achieve from the other surgeries, it gave me a much higher quality of life than I have ever dreamed of having prior to having it.
Since we introduced the spinal decompression into practice, that I have been able to successfully treat at least 80 to 85% of the patients. And when I say success to some of these people, it means total pain-free state.
Now, to be clear, spinal decompression therapy is not some kind of miracle. It doesn't work for everybody, and yes, there are some people who will need to have surgery. But as any expert will tell you, before you have surgery, you should explore every possible non-surgical option. This non-surgical, non-invasive therapy has helped me and thousands of other back pain sufferers get back to living an active and pain-free life. If you want to get your life back and get out of pain, you owe it to yourself to see if spinal decompression therapy can help you.